Welcome to Vitality Made Simple, the podcast that empowers you to feel better, look better, and to enjoy better relationships. It's always about relationships, and we want to feel our very best for our relationships. And that's a perfect segue into our guest today. Dr. David Minkoff is someone I so respect because of how he handles his relationships. He is a physician, board certified in pediatrics. He's worked emergency room. He's worked in just all kinds of infectious disease. But then he had an epiphany, and he's going to tell us about his epiphany. I've heard Dr. Minkoff speak at A4M, and then most recently, two different conferences for the Ozone Society. So he is a wealth of knowledge. He is generous with his time. And I just respect the way he lives his life, and he is brimming with curiosity. Here at Vitality Made Simple, Dr. Minkoff, we really appreciate curiosity. It takes a lot of bravery in this world to be curious. Welcome, welcome, welcome.
Thank you, Debbie. Real excited to be here.
Well, I know that it was a personal journey that sort of started this amino acid party. For our listeners, we're going to talk about one of the many areas of expertise that Dr. Minkoff has, and that's in the area of protein metabolism. He wrote a bestseller called The Search for the Perfect Protein. It came on my radar by my friend Gail that you met, Dr. Minkoff, at the conference. She's incredible. I bet she's given 100 copies away. I've probably given 15 or 20 away, but it's a book that I fully recommend because of its practicality. It just is something that I refer to pretty consistently with my patients as well as with our family. So tell us what started this journey into amino acids and protein deficiency.
Okay. So one of my hobbies is to do Ironman triathlons. So an Ironman triathlon is a race where you combine swimming, biking, and running. And an Ironman is 2.4 miles of swim, followed by 112 miles of bike, followed by 26.2 miles of run. So it's an ordeal, between 11 and 13 hours, depending on the venue. And it requires a lot of training. So I started doing these in 1982 on sort of a lark. And I had such a bad time that I decided I should keep doing them until I felt I'd conquered them, which hasn't happened yet. So I've done 43 full distance Ironmans. Very few people in the world have done that many. But I enjoy it, and I enjoy the training, and it helps me to keep my lifestyle straight, because if you're not healthy, you can't do these things. So I found it probably 15 years ago that I got an injury of my hamstring, and I could not get it to heal. Every time I would try to run hard, it would start to hurt, and then I was afraid I was going to tear it, and I'd have to back off. And I did all the things I knew to try to fix it. I put cold, I put heat, I got chiropractic, I got acupuncture, I got massage, I got microcurrent frequency treatments. I mean, I did everything that was available at the time, and it just didn't seem to make any difference. And so it dawned on me that perhaps my nutrition wasn't optimized, though I thought I was eating a good diet at the time. And I started doing testing for blood levels of what are called amino acids. And amino acids are the building blocks for proteins. So if someone eats a steak or a piece of fish or some eggs, those are full developed proteins. Your body then has to break them down, because you can't absorb egg protein or whey protein or muscle protein. Our bodies have to digest it. In the process of digesting it, the proteins get chopped up into little teeny pieces. And those little teeny pieces are called amino acids. And it's kind of like an alphabet. In the language, like in English language, you have 26 letters and you can put them together in different sequences and in different lengths, and you could get different words. And so amino acids are the same thing. There's an alphabet, there's 22 amino acids, and you can put those amino acids into different combinations to get the different body proteins. And there's probably several 100,000 proteins in the body, hair and skin and livers and hearts and immune cells and enzymes. These are all proteins, and insulin and growth hormone and there's just thyroid hormone. These are all proteins and neurotransmitters, the things that our brain uses to communicate. They're proteins. And so the body is able to take these amino acids and turn them into proteins. And so if you eat a steak and your body breaks it down into amino acids, they can then be absorbed through the intestine. They go into your bloodstream, they go to the cells, and then the cells have sort of a repertoire of amino acids, and they can then manufacture the proteins that they need. So a pancreas cell can make insulin, and a pituitary cell can make growth hormone, and a muscle cell can make protein, and a hair cell can make hair. And so if you're deficient in amino acids, your body can't manufacture all the proteins that it needs because it doesn't have the raw materials. So if you think of cells in the body, there are about 100 trillion cells. Now that's more than all the stars in the known universe. Okay. And each of those cells has an enzyme reaction rate of about 100,000 times per second. So these things are busy and they need raw materials to do the things and keep the body up. Now, like our intestine has to get a new layer every 4 or 5 days. If you're deficient in protein or in amino acids, it won't turn it over every 4 or 5 days. It might be 7 days, 9 days. You get a wound, you get surgery, you work out very hard. You might be sore for a week, but you shouldn't be sore for more than 24 to 48 hours because your body should be able to repair that if it's got the raw materials to do it. And what I found out was that with the injury that I had, I was not getting enough amino acids in to fix the muscle that was torn by the workout that I was doing. And so I started to, I didn't know this at the beginning. I'm telling you now, I know this is what happened. So I started experimenting with amino acids, thinking maybe I was protein malnourished. And I got this combination of amino acids, which is this product that we call Perfect Amino. So it's 8 amino acids. These are what are called essential ones, which means our body can't make them. They have to come in from the outside. And so it's like a vitamin or a mineral. You can't make magnesium. You can't make vitamin C. Like you've got to take these in or your body doesn't have them. And these 8 essential amino acids are like that. You got to take them in or you can't have them or you don't have them. So what I found is that when I had this combination, which is called Perfect Amino, of these 8 essential amino acids, and I started taking them, a whole bunch of things happened in my body, which surprised me like amazingly. One is within 6 weeks, my hamstring completely healed. Like there was no more pain. There was no more problem with it. And sorry, I got a mosquito here. And it healed up. And I did a triathlon 3 months later, an Ironman triathlon. I had my best time ever. So by a lot. So my body actually got much stronger. Now, what I didn't realize is because I had been not getting enough protein for many years, is that my body had backlog of a lot of stuff that it wanted to fix, but it couldn't. Because I was stressing it every day with workouts. I wasn't supplying enough. And so it had this backlog, which I didn't know about. So I gained 9 pounds of lean body mass within about 3 months of starting to take the product. The lean body mass is bone density and it's organ size. And my body didn't really change. Like I didn't look bigger with the 9 pounds. It was all internal rebuild and get to optimum state all these organs and tissues and connective tissues and all this stuff. And then what else happened is one of the things I utilized for exercise to gauge intensity is maximum heart rate. And my maximum heart rate had been 172 for years. And after I got the full effect of taking the amino acid supplements, my heart rate my heart was able to beat 12 beats faster. I could go 184 as my maximum, which is a lot. So these are things that, that people don't think of. And so what I started to do then is test blood levels so I have a clinic and we see a lot of different kinds of patients, from real high-end athletes to people who have chronic disease. They have cancer and chronic fatigue and Lyme and, neurological disease. And so I started to test people's blood levels for amino acids. And what I found is 90% of people that I was seeing were deficient in amino acids. Like, they were low. And mostly they're low because they're not eating enough protein. They're not able to digest the protein that they take in, and that their intestines are messed up enough that they can't digest and absorb the proteins that they're eating. Because 90% of people have parasites and yeasts and bad bacteria and leaky gut and all this stuff, and not enough digestive enzymes, which are also proteins, to digest their food. And so I was looking at this thing and I'm thinking, like, everybody needs this stuff. And so that's how I got into it. Now, so the next thing that happened was, so I have this race and I do really well, like the best I'd ever done. And I write an article about my experience in Triathlete magazine. So Triathlete magazine is, triathletes subscribe to it because you learn all this stuff. And I got 3,000 letters back on, I want this stuff. Like, I want this stuff. What, you have a good story here. And so we had started another company. We call it Body Health. And it was making some nutritional supplements. At the time, it was mostly mercury and heavy metal detox products. And so we started to manufacture this blend of perfect amino, of these 8 essential amino acids. And then we had customers. And so now we have customers all over the world who buy this product. And it's fantastic because it fills a niche in virtually everyone, and it improves their health.
Well, the proof's in the pudding with your physique and metabolic health, Dr. Minkoff. What was your eating routine before that got you into that depleted state?
Well, I really thought that vegetarianism was the right way to go. I mean, I was mostly a vegetarian. And I know now, because I've measured so many amino acid profiles in so many vegans and vegetarians and plant-based people, and I can tell you, you will be malnourished if that's what you eat. There are a few people who it will supply what they need. But if you start measuring levels of amino acids and essential fatty acids and muscle mass and body composition, is within probably 1 to 2 years, if you're a vegan or you're plant-based, your body is going to deteriorate. It's almost everybody. Now, you could pull it off if you take enough perfect amino, because you need proteins. The plant proteins are not really effective at keeping our bodies as healthy as they should be. They just aren't. It isn't sort of people have different reasons for being vegetarian, and whatever your reason is, like, fine. I wouldn't argue with anybody about this. I would just say that if you're doing it because you think it's more healthy, there's a high chance that it really isn't, and that you just don't get the things that you need by eating that way. And you can pull it off if you pay attention to iron and B12 and omega-3 fats and amino acids. You can do it. And so if I have people that want to keep this lifestyle, I work with them so that they can be well nourished with that. But on the foods alone, they don't really get there. And you see their lean body mass, they deplete themselves. It just isn't good enough.
Yeah, I
So
see that among my clinical patients also. They have some pretty weak immunity unless they're being super careful about what they're doing. So many of the vegetarians that I've seen that needed help were actually sugartarians, you know. Um, so they were just, having um, an overload of carbs, that processed carbs really, that were doing them more harm than good. You mentioned acid blocking medications. Expound on that for our listeners, because in my clinical practice, I'll bet 50% or more people take acid blocking medications, proton pump inhibitors daily. And the interesting thing to me, Dr. Minkoff, is that they sort of think they don't need to tell me. Like they think it might be like an aspirin or a Advil, or, so when I see their lab results, I use a GI map, and I can pretty much guess if they're taking those, and they're like, well, I didn't think you needed to know. But just give us all the details, because I think this is an area of expertise that you have, to explain this in very practical terms. We need that.
yeah, so in order for the body to function properly by design, your stomach is the entrance point for your whole internal organ system. Okay, your lungs are an entrance point, and your skin to some extent is an entrance point. But most of the stuff that comes in through the mouth. So the things that we eat and the things that we drink come in. And then they gain access to our internal body. And the stomach is the place where our main defense is, because very few people are eating food that is sterile. Like you eat a salad, it's not sterile. You know, you have meat on a grill, you could culture bacteria off that thing. It's not sterile. And the body by design has a way to kill stuff that's coming into the stomach so that it doesn't then get inside you and produce an infection, whether that be a parasite or a fungus or a bacteria or even a virus. So the stomach produces an acid. The stomach cells themselves, they're called the parietal cells of the stomach. They are able to produce very, very strong acid. Now, acids are measured on this scale called pH. And pH is the hydrogen concentration. So acids have hydrogen. So very acid is 1 on this scale. Water is 7. That's neutral. And things that are very alkaline go up to 14. So the scale is a 1 to 14 scale. Our stomachs produce acids in the range of 1, like 1 to 2. Like this stuff would burn through a table. It's very acid. So if you eat and the acid is prompted to be secreted by these parietal cells, it kills the bad guys before they can actually get into your intestine and cause you harm. The acid is also required to turn on the first stage of protein digestion. So there is an enzyme that's also made by these cells in the stomach called pepsin. And pepsin starts to break down long chains of amino acids, which are proteins, and break them up so the digestion process can happen. And the pepsin doesn't work unless the pH is 1 or 2. Now, in order to absorb minerals, you also need an acid environment. So magnesium and potassium and chromium and zinc and selenium, in order to absorb these minerals, you need acid around to do it. Okay, so these are like 3 super important areas. You won't get your proteins, you won't get your vitamins and minerals, and you won't kill the bad guys that are coming into your body. So there are drugs which chemically block, really poison the stomach cell's ability to make acid. And so if you take these drugs, Nexium and Pepsid and Tagamet, there's a whole bunch of them. They poison the stomach cells so they don't make acid. Now, the FDA in the physician's desk reference, which is the reference for drugs and all the side effects and all the uses, dosages, says in there about these drugs that they should not be used for more than 2 or 3 weeks because they're dangerous. Now, virtually every GI guy will have people on these for years and even decades. Because what's happening is they're eating foods that they either can't digest well or they're allergic to, and they're getting stomach symptoms, and they give them the drugs, and it makes their stomach not produce any acid at all, and they don't get the stomach symptoms, and they think that they're just fine. And if you look at the ads on TV, it says, oh, I just had this hoagie from Subway, and I was getting stomach aches, and now I'm taking Nexium, and I'm all happy, and my stomach is fine. Okay. So if you have to take a drug because some food is bothering you, then you are taking the wrong food. Okay. It's just like that's just a little bit of common sense. Okay. So most people are on these for a long time. Now, these drugs used to be prescription, and now they're over the counter. So anybody can take them. And, you know, if someone has a bleeding ulcer, well, they better be on these drugs for a while, a couple of weeks, 2-3 weeks, because you don't want that acid burning more an area of the stomach which is already opened or injured. Okay. So there is a use for these drugs. It's not like they're terrible drugs. They're just doctors that aren't thinking, or people that don't know they're using them or really abusing them in the wrong way. So if you want to live a long time, you can't take these drugs because you will become mineral deficient and you will become amino acid deficient. And you will get, which is a very common diagnosis today, it's called SIBO. SIBO stands for small intestinal bacterial overgrowth. How do you get SIBO? You don't have stomach acid. And the bacteria that are in the sushi that you just ate, or the parasites that you just ate, or the rare meat, or you're chopping salad on a cutting board where there was just some raw meat being done and it wasn't washed off carefully, well, those things are coming in you. If you have good stomach acid, it doesn't matter. But if you don't have good stomach acid, you can get infected. And so people have bloating and heartburn and gas, and they don't feel well, their stomachs don't feel well. And then the doctor makes a diagnosis that they've got small intestinal bacterial overgrowth. Guess what's happened next? Is now they're going on antibiotics. And these antibiotics are now going to mess with them further, because the antibiotics aren't just going to kill the bacteria in the small intestine. They're going to kill the bacteria in the large intestine too. And now you're going to get overgrowth of yeast and other, worse bacteria. So, that's stomach acid, and that is really an important thing. Now, the irony of this is that most people who get relief by taking acid blockers actually need more stomach acid, not less. So what happens in the physiology, there's a valve at the top of the stomach. So you swallow, there's a tube called an esophagus. It goes down to the stomach, and there is a valve there. There's a valve that closes so that the stomach contents don't back up into your esophagus. So probably most of the people listening have heard this GE reflux, or GERD, gastrointestinal reflux disease. It means the stomach contents are going up in the esophagus. The stomach is built for high acid. It's got a protective lining. The esophagus isn't. And if you have a stomach pH, which is like, say, 4, like vinegar, it isn't enough to activate the protein digestion. It isn't active enough to kill the bad bacteria. But it also isn't active enough. The thing that makes the stomach valve at the top close is high acid. And so if you don't have enough acid, you're going to burp this stuff back up and you're going to get heartburn. And if you take Nexium, it'll go away. But really, you're doing the exact wrong thing. And I had somebody yesterday come up to me and say, I heard you say that you should take stomach acid if you have heartburn because you don't have enough, rather than take things that block stomach acid. And he said, I took it for a week and my heartburn completely went away. And I said, well, you just keep taking that with your meals, because then you won't get this thing. You don't need an acid blocker. You need acid. And as we age, most people over 40 don't make enough stomach acid. And they need enzymes and they need acid to take along with their food to protect them, to make their stomach work right.
So, Dr. Minkoff, when the typical person comes in and they've been on, you know, Prilosec for 6 years, what recommendations do you give them?
So first of all, I make sure that I make sure that they're eating foods that are healthy. You know, like I want them on whole organic foods. We usually put people on a sort of a paleo, autoimmune paleo diet. So it's meat, fish, eggs, fruits, vegetables, nuts, and seeds. Okay. We have them stop dairy. We have them stop all beans, stop all grains, stop all packaged foods. Okay. Most people do well on this. And then, because I want to make sure the food that's coming in is good food for them. Then, if they're on these drugs, I add stomach acid to their regimen. So they'll start with a couple of these capsules, which have digestive enzymes, plus betaine hydrochloride, HCl, it's acid, with their meals. So I have them eat half their meal, take a couple of these enzymes, finish their meal, and see how that goes. And in most people, they find that their digestion's better. Now they actually have stomach acid. Now their digestion's better. And then over time, slowly wean them off the acid blocking drugs. You can't usually do it very fast if they've been on it for a long time. So I have them just like cut the dose a little bit, wait a couple of weeks, cut the dose a little bit more, and most people can get off of them, and it's not a problem.
No, that's really exciting. Because of course that segues perfectly into another question I had for you, and that's regarding osteoporosis and protein deficiency.
Yeah. So the byline, you know, the American Osteoporosis Society says take your calcium and take your vitamin D. Okay. Very, very few people are calcium deficient. Lots of people are vitamin D deficient. So I'm on for the vitamin D. The anatomy of bone is that about 50% of the bone is a protein. It's collagen. It's like a structure. Like if, and those people who remember how they used to make plaster walls, there would be this stuff called lath, which was these little strips of wood.
Yeah.
And then they would smear the plaster on top so it had something to stick on. So our bones are made similarly. Our bones have a framework, which is collagen. And onto that collagen goes calcium and phosphorus and a couple other minerals. Now, if the collagen isn't there, there's nothing for the minerals, for the calcium and the phosphorus to stick to. Now, with aging, people start to get, they are protein malnourished. Their bones are turning over, but if you don't have fresh new amino acids to maintain and grow your new bone, your collagen matrix is going to go from what, you know, might look like this to like maybe looks like this. It's got big holes in it, and there's nothing for the calcium to stick to. Now, if you give people with osteoporosis calcium, you do not fix their osteoporosis at all. It is not true. You just put calcium in their arteries and in their all the other places where it's not supposed to go. So what we found is that if you give people enough essential amino acids, so perfect amino, they will start to really make collagen. And then if you make sure that their vitamin D levels adequate, that their hormone levels are adequate, like you need estrogen and testosterone and DHEA and progesterone to make adequate bone. So we have to optimize their hormones. And then we have to add a third thing, is we have to do something that actually loads the bone, stresses the bone. You know, you can put someone on a vibroplate, you can have them do jumping jacks, you can have them run, you know, you can have them walk with some impact, and you can get, now you have all the stimuli that you need to build big bone, and you'll find in 6 months the bone is, you are remineralizing people. And the drugs that are used for osteoporosis are all poisonous to the nth degree. You see it with people with their jawbones, but you see it with them eroding their stomachs, and their bones aren't any better, and it's that's like a whole fiasco. Like those are, that's the wrong thing to do.
Yeah.
Giving drugs for stomach acid is the wrong thing to do, and giving drugs for osteoporosis is the wrong thing. It just doesn't work.
Well, that's what's so incredible about integrative medicine. I love it, love it, love it. Complementary medicine, we help get the body healthy from the inside out. One of the things I heard you say, I don't know how long ago at A4M, was that muscle is longevity. So tell us about, if I can ask your age. It's rude to ask a woman her age, but is it rude to ask a man his age? I don't know. But um, give us your biological age, your chronological age, as well as your biological age. And I think that's going to really help inspire our listeners that muscle really is longevity.
Okay. So the two most important tissues in your body are your proteins and your brain. Like if you have proteins and you can maintain your brain, you can maintain longevity and health. And so the whole point of these amino acid supplements is to maintain your body protein and to eat enough regular proteins. I mean, people aren't going to take tablets or drinks all day long. They want to eat. And if you're not eating enough quality amino acids, which is meat, fish, and eggs, you're not gonna hold your muscle, and you're not gonna hold your brain power. So I'm 74, and in 2 weeks I'll be 75. Now, I have a very full life. I work 50 to 60 hours a week. I train for Ironman triathlons. I have a wife of 50, almost 4 years. I have 3 children, 9 grandchildren. I write books.
Congratulations.
I
Yeah.
lecture all over the place. And I am so there's tests you can do for what are your chromosomes actually. So I'm about 10 years younger on the chromosomes, but on my immune age, there's tests now that test for immune age. My immune age is 52. And in the lab that does this, they said this is the biggest gap they'd seen from anyone that they've tested. This is the True Age test. I don't know if you've done it.
Pardon me, what's
Ryan
it called?
Smith.
True
It's
age.
called True Age. Yeah. And so you can send a blood specimen to them, and they'll do a profile on what is your genetic age and your immune age, and then suggestions on how you can improve it. And so it's fun to be. I mean, my dad died at 71. My mother died at 74. And they could not do. And so last weekend, I was in Kona, Hawaii, doing a half Ironman under very extreme conditions. And I did great. And I was able to do it. So I swam 1.2 miles in the ocean, rode 56 miles in the lava fields up to Hawaii, which is it's about an 8 or 10 mile climb in, 85-degree heat, 85% humidity, very windy, so very tough conditions. And I did fine. And it can be done at this age if you work at it to maintain a lifestyle so that you keep your body. And I think, Moses made it to 120. Okay.
Yeah.
So if the Bible is a stable data for smart things to do and not do,
I agree with that.
well, I think it's possible to do that, but it isn't possible if your lifestyle isn't, compatible with biology, which is living things. So if you're eating things or exposing yourself to things that are anti-biology, they're toxic to your tissues, you can't do it. But, like I decided a long time ago, I wanted to, live as long as I can and stay productive as long as I could. And this is what you have to do. There's sort of no free lunch in this area. You can't cheat. There's no cheating. I mean, these are living cells, and you put a poison on a living cell. If you're looking at cells in a petri dish, you can see we look at blood under the microscope, and you can look at the cells, and you put something toxic on that plate, you can see those cells. They go, ugh, or sometimes they just break, or sometimes they just swell. And so you just multiply over that on your body. And if you eat poisonous stuff and you subject yourself to poisonous stuff, your body's going to take a hit. And, it can tolerate it. So doing these races is not exactly healthy. Okay. It's not, there's probably better things I could do. But if you're ready for it, if you put the training in and your cells are adapted to those kinds of stressors, you can do it. And it's now a week and 2 days. And, I went to my swim workout. I swam almost 2 miles this morning in a group. It's super intense. And then I went for a 3 mile run. Michael, my body is recovered. I can do it. And I can do it because it's learned the game of how do you survive. And it's 5:30 here. I got to the office this morning at 8 o'clock. I've been seeing patients all day long. And I'm going to go home, and I have a whole night planned, because if you're doing things right, you have energy and you have vitality, and your systems work, and you can really live. And
enjoy your
I think
relationships.
enjoy
Yeah.
your relationships. Yeah. So, most people now age faster. Their chronological age might be 60, but by 40, they were acting like they were 60 or 70, and their bodies had the capability of that. And it's almost never too late to change it. Like, it's really never too late. You can turn these things around and get a performance change in people. Performance means that you can do stuff. You can sit down on the floor and you can actually get up, you know?
Yeah.
So I was horsing around last night in the pool with three of my grandchildren. We're playing pool basketball. And then they want me to grab them and throw them up in the air, and one's 4 and one's 7 and he's 11. And I can do it because the vigorousness is there.
Oh, well, and that just translates to mental vigor too. I mean,
Yeah.
it's all connected. So, you said it's never too late. So, tell us some of the real life stories you've seen in your clinic, because I know you see people from all over the world. So, there's probably some pretty fascinating tales you can tell us.
Yeah, I mean, some of like, it's a daily thing. Like, most people come in here and they're having a hard time with fatigue and brain fog and body pain and GI distress. Okay. And they come in with all different labels. It might be they've got Crohn's disease, or they've got ulcerative colitis, or they got fibromyalgia, or they got chronic fatigue syndrome, or they've got cancer, or they've got Lyme disease. And they basically come in with a whole set of stuff that's very similar. And when we look at their bodies, we find basically two things wrong. One thing is there's things in their body that shouldn't be in there. Like, there's infections and toxins at a level that's too high for that body to cope with. And so the body's poisoned and it won't function right. And that creates pain, and it creates disability, and it creates weakness, and it creates brain fog and all these other things. The other half of this is that their body is missing things that the body has to have to perform. The body's kind of like an erector set. If you have an erector set and you're building something, and you have in key areas missing screws or missing attachment pieces, that erector set is going to be wobbly. It's not going to be able to do what you want. And so in your body, I guarantee you're low in amino acids. And most people are low in omega-3s, and most people have vitamin and mineral deficiencies. These are easily measurable things. We could say, by golly, your selenium and zinc are low, and your molybdenum is low. It's just another mineral. And your amino acid profile sucks. And you have way too many omega-6 fats in your body and not enough omega-3s. And, oh, yes. And then over here, we've got, okay, your intestine shows that you've got a bacterial overgrowth and a yeast overgrowth. And, oh, there's 2 parasites in there. And, oh, by the way, you've got root canal teeth that show that we do the cone beam CT scan and there's abscesses at the root. And today I saw a person who's got severe cardiac arrhythmias, and she's got a gigantic cavitation on her number 1 tooth, which I injected some ozone in, And she felt her heart calm within about 30 seconds of just doing the injection. Okay. She's probably going to need a procedure there, but I was just doing an experiment to see if I could get an effect. And she was like, oh my God, that feeling I have of irregularity and palpitations just like reduced within seconds of doing that injection. So that these things are things, so these are all fixable things. You know, you can handle the dental work. You're an expert on that. I send people to dentists. You know, I refer like probably 300 people a year. I have filled up 3 dental practices with referrals
You're
because
one of the,
the
excuse me.
dental stuff is so important. Okay. Nobody's healthy with bad teeth. Okay. And then the other stuff, you can fix the gut and you can fix the deficiencies. And when you do those things, the body starts to, now it can start to produce energy. You can balance the hormones. And now these people start to come alive and they come back here. So we do the symptom score. So the first day they come in, it's a whole checklist of, do you have this, 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 and this? And on a 1 to 5, what is it? And so really sick people have 140, 150 at the total. Almost 85% of the time, that within 2 months. So I see them, I put them on this program, I have them come back in 2 months. And before I see them, I have them do the symptom score again. Now they don't remember what they did the first time, and they don't remember what their answers were the first time. They just fill out the thing again. And 85% of the time, it's gone down by 50%. Their symptom load is 50%, sometimes even 70% reduced from what they were before. They didn't even remember how bad they were before. And they come in and say, well, my brain fog's gone. You know, I've actually got some energy now. I'm sleeping better. You know, I was having trouble with my bowels before because I was having constipation and I was bloating, and I don't have the bloating before. And I'm going to the bathroom every day. And like, this is like a miracle for people who sometimes have been suffering so long, they don't think any change is possible, or, you know, they've just sort of given up. But that's not really true. If they will do the program, they can get an improvement.
Well,
And that's a lot of fun to do that with people.
oh, so much more fun, I'll bet, than what you were doing before you started doing this in medicine. The fascinating thing I think too, Dr. Minkoff, is that you lost your parents when they were young, but that didn't make you think, oh, I'm going to also die young. I just hear so many people saying, you know, diabetes runs in my family. And, you know, I joke that, you know, diarrhea runs in my family, whatever. But, you know, just for people to know our bodies are designed to heal. You see that every day. I see that every day. It's possible. It may not seem like an easy road initially. They have to do the work, but it's just so much fun. So when you're,
Can I just jump in here on this one thing?
yes,
Because my genetics aren't good. Like, my dad had his first heart attack at 51. His dad had his heart attack at 51. My brothers had a quadruple bypass. Both my other brother and sister have diabetes, and in fact, I just ran one of the blood tests on my sister for diabetes, and you know, she's not doing the program, so it's, you know, like her numbers are terrible. Okay, so I have sent my genetics, my blood, or my scraping of my saliva to 4 different labs to check my genetics, because when the first one came back, I was like, oh, these are really bad. Okay, like, my genetics aren't good. And no wonder, look at my family. Everybody's got diabetes and they're all overweight and they have early heart attacks. So then I send it to another lab thinking maybe it was just the lab. Now I've done this 4 times and the lab comes back the same. Your genetics aren't your problem. If you made it past, I used to be a pediatrician. The babies with really bad genetics don't even make it to delivery. Okay? There's a bad error and they don't make it. The ones with almost too bad an error make it, but they don't live very long. Trisomy 21. There's these things where they're like, the basic template is really messed up, and those kids don't survive. If you made it to 10 years old, your genetics aren't your problem. Yes, it may be in your family, but 90% is lifestyle. It's not genetics. And you can outdo your genetics. So I've outdone my genetics. I've outlived my parents. I did during this triathlon, it was very hot. It was very difficult. My heart rate was running about an average of 160 beats per minute for about 8 hours. Like that was a good stress test. So I don't have any cardiovascular disease, but it's in my whole family. But I just live differently than they do. And that's the thing that makes the difference. And that's why it's I just repeat this thing. It's really never too late for anyone. You can feel in probably 3 months like, holy cow, I've got a new lease on life, and I'm like, life is worth living. And with that goes an attitude of, I was here for a reason. Maybe I ought to get serious about what that is and get going.
Amen, brother. I totally agree. In your book, you recommend 1 gram of protein for every pound of weight.
Yeah.
Please expound on that. But also, I wonder if people can overdo it in terms of
Well, I
protein.
think so. There's rules and then there's individuals. And so I think you have to, what we're trying to do is see what's the right fit. So if I say someone go on a paleo diet, do this for the next 8 weeks until I see you, for almost everybody that works really well. What we find is if you want to maintain your brain and you want to maintain your muscle, then you got to eat enough protein to do that. And the RDAs from the whoever decides those things are they're just way too low.
Mm-hmm.
So what I want people to do is concentrate on get your minimum protein per day as your first rule of what to eat. So meat, fish, and eggs. Okay. And then watch the carbs. 60% of our population is obese. They're eating too many carbs. They have metabolic syndrome. They have insulin resistance. It's carbs. It's their diet. So you go off that. You eat proteins. With proteins come fats, and you eat vegetables. Okay. Some people tolerate fruit. Some people don't. By tolerate, I mean fruit has a lot of carbohydrates in it. Like my body, I can't eat much fruit. It makes my blood sugar go up. So one of the simple things people can do is get one of the Freestyle Libres, the transcutaneous glucose monitors. And I put almost every patient I see on this for the first 6 weeks. You wear this monitor, and I want to see with what you're eating, what's happening with your blood sugar. If you're having blood sugar spikes, 150, 160, you can't eat those foods. If you eat meat and vegetables, your blood sugar is going to be low. And if you got diabetes, it's going to go away. If you're eating carbohydrates and fruit, you probably are going to have to very much restrict it because your blood sugar is going to go too high and you're going to get insulin resistance, and then you're going to have diabetes or some variation. Mm-hmm. So these are sort of the things that are really important that anyone has control over. And my typical meal is is a protein and like for dinner tonight. When I go home for dinner tonight, I will have a very big salad with probably 6 or 8 different kinds of vegetables in there. And I will have a piece of salmon or a steak or some hamburger. I mean, that's my typical meal. For lunch today, I took some of those nori seaweed wraps, mm-hmm. and I put in some sardines and some avocado and some cut up pickles and some onion. And I rolled it up and I had a couple of those, and that was my lunch. And that's like a really healthy lunch. Like I had all the stuff that's in the seaweed, and I had the fish, and I had avocado. It's very satisfying. I had 2 of those. I was full. And that was at, 1 o'clock. It's almost 6 o'clock now. So these are easy. It's fast. That's a cheap meal. I mean, it's like this stuff, this isn't an expensive lifestyle. This is cheap. And what happens after you start eating this way for a while is when you go to a restaurant, you just don't want to even eat there because most restaurants have terrible food. And you don't want it.
You don't want it. And all this food tastes better. I mean, you don't want it from so many angles, but I think it refreshes the taste buds when we eat more by design. I so appreciate your your perspective of how, our bodies were designed to work, and we have to get back to that, or we're going to feel bad, or you know it's gonna go badly.
Right.
In your book, I want to comment on one thing in your book that I loved. You all, this book is easy to get. It's very inexpensive. If you live in Oklahoma, I'll probably give you a copy, or Gail would. But you have a page somewhere in here that just hit me. Oh, here, okay. It's about the difference between cage-free chickens and pasture raised. I mean, there's a lot of good practical information in this book, folks, because I thought for so long that cage free was a good thing. And there's a picture in here where they're just all crammed up, uh, falling all over each other. And then versus pasture raised. I was raised with chickens, so they need to get out and run and
Eat bugs.
eat bugs. Yeah, and they eat ticks, and they keep your yard looking good, and then you use the fertilizer in your garden. I mean, that's once again back to design, but there's lots in your book that Dr. Minkoff is just, it's just pearls. It's just pearls for people knowing how to do things. And I really appreciate it.
Thank you.
It's a fun read. It's, if you're on an airplane, take it with you, because it's divided up well into sections, and spaced out really nice. I was a proofreader in college, so I really appreciate that nice layout that you did. So I know that you're probably hungry after this long day, and I could talk to you all day. You have so much to tell us. I would love at some point to get to hear about toxins. That's a real interest of mine, of course, with my work. But for today, tell us where people can find you. You have a plethora of resources for people. Just give us that layout, and then I'll put it all in the show notes also for everyone.
Okay. So my medical practice, the website is LifeWorks, one word, lifeworkswellnesscenter.com. And you could go there, and there's a couple hundred different videos on there of all kinds of topics. So there's a lot someone could learn on that. If people are interested in coming to our center to be patients, they can fill out a form, and then someone will call them and talk to them. We have 3 medical doctors here, 5 nurse practitioners. We have a staff of 78 people, so we have a big clinic, and really we specialize in solving unsolved medical problems. That is really our thing. Now, we do see some high-end athletes, and we see some people who just really are interested in getting total health, and they want to really be looked at so that they can live as long as they can. So we cover all those categories. The other website is just Body Health, BODYHELTH.com. Body Health, I started a vitamin company about 20 plus years ago. So we manufacture these amino acids plus about another 30 different products, which are all like the best stuff you can get for the category. And there's a
Pharmaceutical
lot
grade.
of
Yeah.
yeah, and there's a lot of videos on there too. And both sites, I do two newsletters, which are free, and you could subscribe to the newsletters. And so some of them come out every couple of days. One of them comes out once a month. And so you can see sort of what I'm thinking about, or what I'm seeing in the clinic, or tips on health or aging or anti-aging, that sort of thing. So that's the best way to get me. The book's on Amazon. It's also, if you want to read a PDF copy, you could go to the Body Health website and download a free copy, if you want to. And that's kind of that's where you get me.
Hey, we appreciate your time at the end of a day on a Monday. Thank you so much, Dr. Minkoff. And thank you, listeners, for joining. Vitality Made Simple is now in almost 100 countries. I think we're at 98 in 2,200 cities. And it's all because of you. I am no longer a social media introvert. I'm now on Instagram. So join me there. Having a lot of fun. If you want to laugh, go to Instagram, Dr. Debbie Osment, and just share this with your friends. Dr. Minkoff has given us a wealth of information that can help people live younger and more fully enjoy their relationships. Blessings until next time.